Hello, I'm Mallory Duncan, the Program Director of the Rehabilitation Center at Anderson Hospital. On behalf of our entire team, we welcome you to our rehabilitation program. Our program is an accredited stroke specialty program, and we pride ourselves in partnering with you to prepare for life after rehab. Throughout this video, we will share many of the things that you need or might just like to know to move forward with your life after experiencing a stroke. We're here to help you every step of the way. Let's get started. Each year, approximately 800,000 people have a stroke in the United States. More than 7 million Americans are stroke survivors. About 1 of 4 strokes occur in people who have had a previous stroke. Stroke is the 5th leading cause of death in the United States. What is a stroke? A stroke is an accident to the brain that occurs when blood flow to the brain is cut off. Blood flow to the brain carries oxygen and nutrients which keep the brain healthy and working well. When the blood flow is disrupted, some of the brain tissue dies, resulting in a loss of function. The longer the blood flow is cut off, the more damage to the brain occurs. Blood flow to the brain can be disrupted in 2 ways, either by a blood clot blocking a vessel, which is called an ischemic stroke, or by a blood vessel bursting open, which is called a hemorrhagic stroke. About 87% of strokes are ischemic strokes. The way your stroke affects you depends on where in the brain the injury occurs. Some common signs of stroke include sudden numbness or weakness of the face, arm, or leg that occurs on one side of the body, sudden difficulty with walking, balance, dizziness, or coordination, sudden confusion or difficulty understanding words or people speaking, sudden onset of a severe headache with no known cause, sudden difficulty talking, or sudden loss of vision in one or both eyes. A mini stroke, also called a transient ischemic attack, or TIA, has the same signs or symptoms of a stroke. However, the symptoms go away, either in minutes or in hours. Mini strokes are a warning sign that an actual stroke may be likely. If you suspect that you or anyone else is having a stroke, call 911 immediately. Chances of survival are greatest when emergency treatment begins immediately. New advancements in medicine can reduce the effects of a stroke if they are given to the patient as soon as the stroke occurs. Getting to the hospital within 2 hours after symptoms start can greatly improve one's chances for recovery and decrease the effects of the stroke. Have a plan in place in the event that you or someone else has stroke symptoms. People tend to make the best improvements if they are placed in an aggressive therapy program as early as possible after the stroke occurs, so you are in the right place. Rehabilitation involves multiple medical team members, including physicians, nurses, care managers, and therapists of all kinds. Your therapies may include physical therapy, occupational therapy, and/or speech therapy. Physical therapists work on balance, walking, and moving around. Occupational therapists work on self-care skills, such as dressing and bathing. Speech therapists work on swallowing, speech, memory, and expression. Research suggests that recovery can take up to 2 years, with most recovery returning in the first 6 months. Your doctor will prescribe medications for you to take to minimize your risk of further stroke. It is extremely important to take the medication regimen exactly as prescribed. Poor adherence can lead to a much higher risk of further stroke, as well as unnecessary medical complications and preventable hospitalizations. There are good habits you can form when dealing with your medication. Make sure that you are well informed about your condition, as well as why you are taking each prescription. There are many helpful tricks and tools that you can use to remember to take your medications, like setting reminders on alarm clocks or your phone to remind you when your dose is due. Pill boxes are helpful in keeping organized. Medication trackers can also be useful. Use them to write down each medicine you take and how you take it. Make sure that family and caregivers know and understand your tracking system so they are able to explain it to your doctor in case of emergency. If you can't afford your medicines, we have resources that may help. Just ask to speak to our social worker. Taking your medications as prescribed is vitally important. Many stroke survivors experience feelings of anger, frustration, anxiety, sadness, fear, and hopelessness in varying degrees after a stroke. These emotions are extremely common, affecting more than a third of stroke survivors. A combination of factors can lead to post-stroke depression. The sudden nature of stroke can have a life-changing impact. Also, the damage to your brain after a stroke, genetics, and social factors can also contribute to depression. According to the National Institutes of Health, post-stroke depression is underdiagnosed. Your emotional health is just as important as your physical health. Post-stroke depression is described as a feeling of hopelessness that interferes with functioning and quality of life. If not treated and managed appropriately, post-stroke depression can slow down your recovery. Depression can set in weeks, months, or even years after your stroke. Symptoms of post-stroke depression vary in severity, frequency, and duration. Signs and symptoms of depression include persistent sad, anxious, or empty feelings, sleep disturbances, increase or decrease in appetite and eating patterns, feelings of helplessness, hopelessness, and/or worthlessness, social withdrawal, loss of interest in activities or hobbies, irritability, fatigue, difficulty concentrating or remembering details, aches, pains, and digestive problems, or suicidal thoughts. Caregivers, family members, friends, and coworkers can be very helpful in recognizing post-stroke depression symptoms and encouraging you to consult with a healthcare professional. If your depression is left untreated and unmanaged, it can worsen a number of other common post-stroke conditions, such as malnutrition, incontinence, pain, fatigue, and sleep issues. There are a variety of treatment options for post-stroke depression. Consult with your healthcare professional to determine the best course of action. Common treatments include medication and therapy. Antidepressant medications are common treatments for post-stroke depression and may be prescribed by your psychiatrist, primary care doctor, or other physician. Antidepressant medications interact with chemicals in the brain called neurotransmitters to improve your mood. Medication is often combined with mental health therapy provided by a psychologist, psychiatrist, social worker, or counselor. Once you have had a stroke, you are at a higher risk of having another stroke than the rest of the population. Some risk factors are out of our control, like age, gender, or family history. However, there are many ways you can help reduce the likeliness of another stroke. Some things you can do are manage your weight. If you're a smoker, quit smoking tobacco. Monitor and control your blood pressure. Watch your cholesterol. Limit your alcohol consumption. Do not take illegal drugs. Manage your diabetes, and exercise. The loss of function following a stroke is completely different for every survivor, depending on what part of the brain the stroke affected, how much brain tissue was damaged, and the overall health of the person prior to the stroke. The most common problems after a stroke are weakness or paralysis of the arm, hand, and/or leg on one side of the body, numbness, pain, or odd sensations on one side of the body, decreased ability to concentrate, difficulty with expressing ideas and/or understanding, difficulty with swallowing, problems with speech, decreased coordination, difficulty balancing, problems with memory, emotional changes, depression, neglect for the side of the body that lost function, vision problems, sexual issues, or difficulty controlling your bowel and bladder. When you arrived, you received a booklet called Moving Forward After Stroke. Please refer to pages 30 through 34 of your Moving Forward After Stroke handbook for more information about managing bowel and bladder issues and for information about sexuality and body image. Staff are available to discuss these issues in private, so please ask your nurse or any therapist if you're wanting more information. As with any illness, there can also be secondary complications of stroke. Some potential complications to be aware of and look out for are spasticity, or tightness in the muscles, shoulder subluxation, which is a partial dislocation of the shoulder, joint hyperextension, which is too much movement at the joints, contractures, which is when your muscles tighten up to an extent where they resist stretching, and pain. Some people have difficulty swallowing after a stroke. This is called dysphagia and occurs in about 65% of people with stroke. It can cause food or liquids to go into the lungs instead of into the stomach, which is called aspiration. When someone aspirates, it puts them at risk for getting aspiration pneumonia. To avoid complications with swallowing, it is important to know the signs of aspiration that are visible and those that are not. Visible signs include a runny nose, coughing, or clearing the throat frequently during meals. Sometimes aspiration is invisible, and people do not even know they are having difficulty swallowing. This is identified through a swallow study called a modified barium swallow test. Some stroke patients have difficulty chewing and swallowing and require an altered diet to swallow safely. A speech therapist will let you know if you need an altered diet. Mechanical soft diets consist of softer foods that don't require much chewing. When you are at home, you can cut food into pieces a ½ inch or smaller. We recommend to use chicken or beef broth to moisten meats and vegetables. You can use fruit juice to grind or puree foods. Moisten breads with butter, syrup, or jelly. It is recommended to avoid fruit skins and raw vegetables. A puree diet consists of foods that require no chewing and are blended into liquids. It is easy to blend your own foods at home. Just mix equal parts solid food and liquids before blending. Strain to remove any chunks. Baby food is also a safe and convenient option. There are several types of thickened liquids. Nectar thickened liquids are easily pourable and are similar to a thick and creamy soup. Honey thickened liquids drizzle from a cup or bowl. Pudding thickened liquids hold their own shape and are easier to eat with a spoon. Powdered or gel thickeners for all of these consistencies can be purchased at most pharmacies. Stroke can affect any area of the brain, including the ability to communicate, solve problems, and remember things. Aphasia is difficulty communicating. It is typical of strokes that occur in the left side of the brain. It can be expressive, meaning you have difficulty getting your words out. It can be receptive, meaning you have difficulty understanding what is said to you, or it can be a combination. Dysarthria is when a stroke affects the speech muscles' ability to produce clear speech that is easy to understand. Speech can sound slurred if you have dysarthria. People who have aphasia or dysarthria are often very frustrated because they cannot speak or understand as well as they did before their stroke. Stroke often produces reading difficulties. This acquired dyslexia may occur with or without other language challenges, and even when writing ability is normal. The inability to read interferes with work and recreation for many survivors, making it difficult to follow written instructions, pay bills, or use the computer. Many will improve their reading through spontaneous recovery, direct practice, or compensatory strategies. Writing impairments are referred to as agraphia or dysgraphia. In some cases, it is even challenging to recall how to form letters. Writing a check, making a grocery list, composing an email, everyday tasks may become difficult. While you are in the process of relearning these skills, enlist help from caregivers to fill out checks, read your mail, and manage your medications. Acalculia is when a person is unable to perform simple or complex mathematical operations. Tasks like figuring the tip in a restaurant and balancing the checkbook can be hard. As a result, a person may be unable to tell time, follow a recipe, or count change. Whatever challenges you may experience in regards to thinking after stroke, our speech therapy team is here to help. We will work with you throughout your stay and recommend any necessary follow-up services for after discharge. Healthy food habits can help you reduce 3 risk factors for stroke: poor cholesterol levels, high blood pressure, and excess weight. Diets high in saturated fat and trans fat can raise blood cholesterol levels. Diets high in sodium can contribute to increased blood pressure, and high-calorie diets can contribute to obesity. The American Heart Association and the American Stroke Association recommends to eat a diet rich in fruits and vegetables. Choose whole grain, high-fiber foods. Eat fatty fish twice a week. Select low-fat dairy products. Limit saturated and trans fats. Choose lean meats and poultry. Cut back on drinks and foods with added sugars. Choose and prepare foods with little salt, and limit alcohol. If you do drink, do so in moderation. Some affected by stroke have loss of appetite or may have difficulty eating due to swallowing problems or other limitations. To make eating easier, try choosing colorful, healthy foods with strong flavors, such as broiled fish or citrus fruits. Add spices to flavor foods. Cut food into little pieces to make them easier to chew. Encourage healthy snacks and small meals throughout the day. Some signs of malnutrition or not eating enough include weight loss, indicated by loose clothes or dentures, less energy, getting tired super fast, changes in mood, or poor concentration. You may benefit from keeping a diary of what you eat for visual reference. Talk to your doctor if you think you're becoming malnourished. Dehydration is especially important to watch out for because it causes the blood to be thicker and causes it to flow less easily to the brain. Symptoms of dehydration include dry, sticky mouth, sleepiness, headaches, and dry skin. Seek medical attention if you have little to no urination, if your eyes look sunken, you have shriveled, dry skin, or if your blood pressure is too low or heartbeat too fast. Exercise is an important part of maintaining a healthy heart and good blood flow throughout the brain and body. Walking or other activities which make the heart beat faster are called aerobic exercises. Experts recommend 20 to 60 minutes of aerobic exercise 3 to 7 days a week. Start with 10-minute aerobic intervals and build up to 20 to 60 minutes. Arm exercises using light weights like soup cans also help to build upper body strength. Leg strengthening exercise can help with balance, walking, bathing, and other activities of daily living. Gentle stretching exercises should also be included in the exercise routine to maintain and improve joint flexibility. Silver Sneakers is a free fitness program for seniors located at many gyms, such as the YMCA and other local gyms listed on the slide. The program offers unlimited access to every participating gym and fitness center. Weights, treadmills, pools, and other amenities are included. There are also special classes geared towards seniors offered by certified instructors. Our social worker can provide you with more information. Home safety modification is an important topic to keep you safe. When you return home, you might be at risk for certain types of injuries, including falls, burns, cuts, and bruises. In order to minimize any hazards, here are some modifications that may be suggested for the home. Rugs should be securely anchored to the floor with double-sided tape or nails to prevent slipping. Thick rugs should be removed or replaced by thinner rugs. Wearing rubber-based shoes or sneakers may reduce the likeliness of slipping. Electrical cords should be securely taped to the walls or floor and clear of pathways. Furniture should be positioned alongside the room to allow easy access and movement within the room itself. Walkways need to be at least 26 inches wide to prevent bumping into objects. Hallways should be free of clutter and well lit at all times. Additional lamps or nightlights may be needed. Handrails can also be installed. Stairs should be well lit at all times. Outdoor stairs should have weather-resistant handrails installed. Permanent or portable ramps are available. Installation of a lever-handled doorknob may be helpful for people who have difficulty using their hands. Bathrooms are one of the most dangerous places in the house. Bathroom floors should have non-slippery surface, such as a rug, on the floor, secured by double-sided tape. In the bathroom or shower, Use of a rubber bath mat or non-skid decals help provide sure footing. A tub or shower bench can be used so that you can sit to bathe versus having to stand. Grab bars can be professionally installed in the shower. A handheld shower device or an adjustable shower head allows showering in either a seated or standing position. If you have vision problems, reading the hot and cold settings on the shower faucet might be difficult. Knobs with color contrast or big writing are easier to read. Marking the right temperature setting with brightly colored tape is also helpful. Using an elevated toilet seat or a 3-in-1 toilet chair may make getting onto and off of the toilet easier. The toilet chair can be used with the pan in place or can be placed over the toilet with the pan removed. These are available in medical supply stores. The kitchen can also be a challenging place to manage. Plan all meal activities in advance. Keep a clear, open space next to the oven or stove to allow pots and bakeware to be removed quickly from the oven or burner. Stoves that have push-button controls or controls that are located on the front of the stove are safest, as they do not require the person to reach across the burners. Make sure to keep a fire extinguisher handy. Organize cupboards, refrigerator, and the pantry so that the most commonly used plates and food items are easily accessible. Label food containers in the refrigerator in big, bold, dark letters on a white background to make identifying food easy. Phones should be readily available in multiple rooms of the house in case of an emergency. Emergency phone numbers can be programmed into many phones. Phones with large numbers make dialing easier. Certain types of pets may get underfoot and cause a fall, so look out for pets on the floor. Our occupational therapists are experts in coming up with strategies customized for you to help you make your home a safer place. A variety of adaptive equipment is available to make life easier. If you have trouble eating, there are a lot of strategies to try, such as anchoring a food plate to the table with a rubber mat. If you have use of only one hand, a plate guard can be useful. It allows you to scoop food to one side and onto the utensil. Using utensils can be frustrating. There are specially designed knives, forks, and spoons that swivel, have bigger handles, bend at angles, and have extra weight that might be easier to use. Drinking liquids from the side of a cup may be difficult for people who have hand tremors, weakness, or loss of muscle control around the mouth. Using a cup with a lid or a straw will make drinking easier. Additionally, weighted cups also help people who have hand tremors. An occupational therapist can help determine what adaptive devices are best for you. There is a lot more adaptive equipment available to make life easier. Universal cuffs might be handy by giving eating utensils, toothbrushes, combs, brushes, or makeup applicators a larger grip to make them easier to hold on to. A bath mitt might be useful if you have limited ability to grasp. Use of long-handled sponges might aid in bathing hard-to-reach areas of the body. These items are available at medical supply stores. Using a bar of soap can be a challenge because they are slippery. Consider pump soap dispensers, which are easier to manage. Other self-care products such as toothpaste and shampoo are easier to use if they have flip tops instead of screw-on tops. Transferring products from their original containers to squeeze bottles may also be helpful. Dressing may also be challenging for some people. Wearing comfortable clothes with loose-fitting sleeves, armholes, pant legs, and waistlines make dressing easier. Also, replacing zippers, buttons, and laces with Velcro fasteners makes getting clothing on and off less frustrating. There are a variety of dressing aids available at medical supply stores. These include sock aids, button hooks and zipper pulls, reachers, long-handled shoe horns, and elastic shoelaces. Some people with leg and foot weakness on one side benefit from a device called an ankle-foot orthosis, or AFO. Your physical therapist will let you know if you need one. An AFO stabilizes the ankle and foot when you're moving around and walking. Improper fit, however, can cause issues with skin or areas of pressure. Sensation can be altered after a stroke, so monitoring for pressure areas under the brace is critical. Check the skin at least daily to ensure there are no red areas, blisters, or bruises. Clean your AFO daily with soap and water. For people who have had a stroke, being able to safely drive a vehicle may be a concern. Your physician should be consulted to determine whether you are safe to drive. If you are clear to drive, always wear your seatbelt. Avoid driving during morning and evening rush hour traffic. Drive on roads that are familiar to you, that are clearly marked. Avoid driving at night and in bad weather. Avoid distractions. Turn off the radio and never use your cell phone while driving. Keep the windshield clean for visibility. Our social worker can provide more information on driving resources. There are several local driving evaluation centers. Your physician is the one who determines whether you qualify for a handicap placard for your car. Your physician would need to fill this out as indicated by the Department of Motor Vehicles. Traveling after a stroke may be more challenging than it was before. Whether it's an overnight trip or a long vacation, travel can be safe and enjoyable. Always consult your physician before making any trips. Before traveling, you may want to call the hotel in advance or look at it online. Does the hotel have a walk-in shower or grab bars in the bathroom? Feel free to ask for a handicapped room, preferably on the first floor or near the elevator if on a higher floor. Air travel is doable with a little advanced planning. Call the airline in advance to arrange a wheelchair if needed. When booking your airline reservation, make sure to notify the airline if you will need pre-boarding assistance. Book non-stop flights if possible. If you are traveling in your own wheelchair, there are airport personnel who can assist in pushing you through the airport. Check your luggage and don't try to carry more than you need to. Keep a small carry-on bag with you. This should contain all of your medicines, emergency contact information, and phone number. Allow yourself extra time to get through airport security and get to the gate. You will need to remove all items from your pockets and to remove your shoes, so you may want to consider wearing sneakers with Velcro to make taking your shoes off easier. Socializing with others can decrease your risk for depression and provide you with the emotional support you may need. This can be done through support groups, community participation, fitness and leisure activities, stroke advocacy, and more. There are millions of people who suffer stroke and caregivers who have similar emotional changes after stroke. Support groups offer a chance for people to share stories and feelings, and to feel connected to others who have gone through similar events. Anderson Hospital offers a stroke support group every other month right here on the rehab unit, and we would love for you to attend. Our recreation therapist will be providing you with a handout of dates and times before you leave. There are many fabulous resources for more information about stroke and recovery. The American Stroke Association and the National Stroke Association have a multitude of resources about life after stroke. You can sign up to receive a Stroke Connection newsletter and Stroke Smart magazine. They have many wonderful resources for caregivers as well. There are also volunteer opportunities through the American Stroke Association, like leading an ongoing support group, advocating for change in federal, state, and local policies, hosting fundraisers, or being a social media volunteer. If you are a caregiver, you take on the responsibility of the therapy staff, nurses, and the physician. Make sure to take time for yourself and accept help when needed. It's okay to take a break. Don't be afraid to ask questions. Caregivers becoming familiar with the symptoms of common complications of stroke is a critical component in wellness and prevention. It is very important that you take time for yourself. We have resources available to assist you. Some examples of resources we have include topics like adult daycare, private duty and personal assistance to assist in the home, and respite care, which is a short-time service, typically within a nursing home, that allows you a break to go out of town or for other reasons. There is a stroke support network for caregivers online, which provides blogs, discussion groups, information, and resources. Please see the social worker for other resources for caregivers. Don't let another stroke happen to you. Up to 80% of second clot-related strokes may be preventable. Reduce your risks by working with your doctor to develop a prevention plan related to the topics we have covered today. Adapting a healthier diet, getting plenty of exercise, and being on the right medication regimen will set you up for success in preventing further strokes. Furthermore, the safety tips and equipment we have reviewed today can help you live a safer, fuller, more independent life. On behalf of our whole team at the Rehabilitation Center, thank you for choosing Anderson Hospital for your post-stroke rehabilitation needs. Our staff is available 24/7 to answer your questions and help you understand how to move forward with your life after stroke, now and after you leave our care. Thank you for watching our video and good luck in your stroke recovery. We are here with you every step of the way.